Anyone can develop back pain, no matter who you are or how old you are. And there are conditions too. And while some of them can be fixed with surgery or physical therapy, others last forever. Hi, my name is Scarlet Weinstein, and I'm here to tell you the most common conditions, causes, and the inevitable consequences that come with back pain. But before I can get into the statistics and the facts, I need to tell you a story. In the spring of 6th grade, I went to an orthopedist at 9 in the morning on a whim my doctor had. It didn't go too well, considering I was diagnosed with idiopathic scoliosis, which is a lateral curvature of the spine, and the cause is unknown. Looking back at photos, my parents claimed that they could see it now. The uneven shoulders, the elevated hips, the weird leg length. I didn't care too much, though. I was too busy trying not to cry every time the word scoliosis was even mentioned. It didn't help that scoliosis wasn't too common at my school, so I felt even more singled out. And it didn't stop in the summer when I went to sleepaway camp that year, and girls would ask me questions about the back brace. Is it tight, Scarlet? Oh my God, is there Velcro? At first I would answer them, thinking that they were just trying to be polite, till I saw them laugh with their friends, and I realized that they weren't trying to be polite after all. It didn't help that I basically had to wear the brace all day, so I couldn't wear things that everyone else wore, because then the brace would stick out at every other angle. That school year, I had a friend who would run up to me and punch me in the stomach because I was plastic. Fast forward to 8th grade, where finally, I could be normal. No more hot days where I couldn't breathe because of the brace. No more baggy clothes. My hours got decreased. I could look like everyone else for once. I could be normal. I could feel normal. Till I made a stupid decision that got me into the spotlight of my other peers. And it wasn't the good kind. Boys would then make fun of me because of the back brace from years past, and they would call me names. Despite the fact that I eventually got that spotlight off of me, those words never left my head, and they made me feel like I was a freak. Throughout that time, and while it might have been because I lost a lot of my energy, I stayed quite observant. I noticed kids in my Spanish class slouching while they did their work, and I noticed boys in the weight room overusing and incorrectly using the weights. I was very, very angry. How come I was the one with the back brace, despite the fact all of these people were doing these obvious things that would hurt their back? I started to look outside of school, and I noticed some different things. Older people with walkers and family friends who wouldn't go into the ocean for fear of hurting their back. I realized that while I might have been getting the short end of the stick right now, these people, good people that I knew and loved, would be getting it for a lot longer and a lot later in the future. So I started to help. I would slap my friend's leg when she was slouching in chorus. And one day when I was at the mall with my friends and one of my friends was complaining about back pain, I pulled her aside and told her different stretches she could do when she got home to ease said pain. Even after I was done with the back brace, I still stayed an advocate and a voice of searching for younger girls who would then come up to me and tell me that they would be getting a back brace in the near future. But I was curious. I began to look deeper into the causes of back pain, and I realized that they were a lot more circumstantial than I had originally thought. Any of you guys could be doing these things and may not even know it, and screw yourselves for the future. But don't worry, though. The most common cause and the biggest factor is lifestyle, which is constantly changing as you get older and progress further into life. Lifestyle then splits off into smaller factors like being overweight, lack of exercise, and misusing weights. When you're overweight, the excessive pounds put pressure on your spine, which increases inflammation in the vertebrae. Also, your spine acts as a support system, so when more weight is added, the spine can't do its job properly. Then, when it comes to lack of exercise, you're prone to weakness with age and also stiffness in the back muscles. And why be doing that when you could exercise and release endorphins, which are the body's natural painkillers? They also make you super happy too, so that's a bonus. But be careful though, because as I said before, misusing and overusing weights are one of the main factors that go into lifestyle of back pain. When you misuse or overuse weights, you are susceptible to something called strains and sprains, which are relatively similar. A sprain can stretch or tear muscles and tendons, while a strain can just tear ligaments, no stretching. Also, misusing and overusing weights can make you susceptible to a condition called spondylosis, which is stress fractures in the vertebrae. Unfortunately, though, even if you're great with these things, you can still be susceptible to a back condition when you get older, especially if you have a family member who has a back condition, or you're like me and you have a back condition too. The most common ones that you'll hear are degenerative disc disease, spinal stenosis, and developing a herniated disc. Degenerative disc disease is when the discs in your vertebrae break down, which causes pain in those specific parts of the vertebrae. It usually occurs with age, but there are some cases where degenerative disc disease happens with injuries, so look out. Luckily, though, degenerative disc disease can be soothed with physical therapy, medication, and in some cases, surgery. If you're concerned about it, talk with your doctor and they can perform a physical exam on you to check to see if you have it. Same thing with spinal stenosis, where with spinal stenosis, it's the narrowing of your spinal canal. But depending on where it is, you can either have lumbar spinal stenosis or regular spinal stenosis. Lumbar spinal stenosis causes greater pain in the lower leg area and even makes it difficult to walk. Unlike degenerative disc disease, spinal stenosis only really occurs with age. But you can have surgery and you can do physical therapy for spinal stenosis. There are some severe cases, though, where one may have to get steroid medication for spinal stenosis. The last thing is a herniated disc, which, oddly enough, is very different compared to the other two. You can get it at any point in your life because it's a lot more circumstantial, considering the main factors are being overweight and overusing/misusing weights. You see why I mentioned that before? A herniated disc occurs when the inside of the disc in your vertebrae leak out, which just causes inflammation and potential infections in that area. Luckily, unlike degenerative disc disease and spinal stenosis, a herniated disc can be healed with time, help from doctors, but it usually doesn't require surgery. So when you see someone who it may look like they have a back brace, be sympathetic. It's a lot that they're going through. If you realize that you're weighing more than usual or not really exercising, or you feel super sore after working out, stop and think to yourself, do I really want to have spondylosis? And finally, be considerate to those who have a herniated disc, spinal stenosis, or degenerative disc disease. After all, they weren't here for this TEDx talk. Thank you.